All right, we're at 11:02, so I think we're going to probably get started here. We've got again Lori Eaton with us from our membership, who will let you in one by one for those of you joining us late. So first and foremost, let's just start off with some introductions and some welcomes. And with that, I want to start with, again, thanking Lori Eaton, who's with our membership department for the Metro Chamber, for organizing this, putting this group together, and assembling many of our great diverse representation of our membership. My name is Erica Bjork. I lead a lot of the policy and advocacy and strategic initiatives for the Metro Chamber. And we're very excited about today. I think the timing is great when we talk about kind of this idea of back to business, and especially the HR implications to this, and some of the legal implications that for many of you that are both employers and employees might have questions on. And we have two amazing experts with us today, both Metro Chamber members that we're excited to include us. And so with that, I'm going to start by introducing our two members. I think you all had access to their bios before. They both have, we'll just say, enough credentials and similar behind their names to fill in an entire line. But to start off with, we have Jennifer Madden, who's a partner in employment law at Delfino Madden. And we have Amelya Stevenson, who again, multiple roles, but also is the Vestige Chair and President of eVentex. I believe I got that right, Amelya. Both are amazing, incredible, and two of the, again, foremost experts, not just in our region and the state, on many of the issues we're going to talk through today. Quick housekeeping for all of you. Again, for this, we're going to start off running through a couple slides and presentations, and then there's a couple ways you can share questions. If you would like to, feel free to put the questions in the chat area. We'll be leading a Q&A towards the end. If you have a question that doesn't get answered, we'll absolutely follow up with you. Or if you have a question that you want answered at a later stage, let Lori know, but we do want to save some time for the Q&A at the end. And real quick, while we get into it, and before I introduce Jennifer and Lori, we can probably go to the first slide on this one. As we kind of start talking about returning to work, I'm going to give a real quick update. Literally about less than 5 minutes ago, the Sacramento County Board of Supervisors voted to move the public health order and their activation into what we call the later part, or sometimes they're calling it the Section B of Stage 2, based on the governor's health orders. We're going to get into some of those details today. Yesterday, the California governor set some revisions to what those requirements are, opening up for multiple counties, including Sacramento County. But the Board of Supervisors literally just met, discussed this, and you can anticipate seeing some more revised guidelines and details from the Sacramento County as soon as the end of this week. The county health director indicated that they would see things such as in-dining with some guidelines with restrictions for our restaurants as soon as this weekend, and some partial retail opening. So we'll get into some of that as we kind of look towards it. The good news is we are near, not quite all 6 counties. I believe YOLO, I think, is still working on some of these updates as well, but a lot of what we're going to talk today helps with businesses as they grapple with this and where we go. And so with that, I'm going to turn it over to Jennifer, who I think is going to lead us off.
Thank you very much, Erica. Good morning, everyone. This slide gives kind of a framework, the construct within which we're working right now. All Californians are covered by the state shelter-in-place order as well as their local county order. And so, as Erica mentioned, there are many counties in California that are now fully through Stage 2, about 24 of those, 58 counties. And those are more of our rural counties, including Sutter, Placer, Colusa, Yuba. I understand that YOLO is going to be submitting a request to the governor later today to move more quickly into Stage 2. And as mentioned by Erica, the governor announced yesterday that the no death count requirement to move into Stage 2 has been eliminated. And now we're looking at no more than 25 cases in 100,000 residents as the triggering requirement. So, you know, the estimates are that we're probably, the hints, I guess, the governor gave yesterday were, you know, hair salons soon. It seems like everyone's dying for a haircut. So if we could look at the next slide here, That'll be the personal service group, although those remain closed now. So churches and hair salons, I think what we're hearing from the governor is he's intimating that that's the next set. And then stage 4 is going to be, the large group gatherings, sports with spectators in attendance, concerts, etc. So that's kind of just the framework that we're working under. If we could go to the next slide.
Jennifer, I'm going to jump in just really quick on this. And on the stage 3 and the stage 4, and not mainly just because it was comments from the health director this morning.
Sure.
I know the big question everyone's saying is when. They're anticipating, again, stage 3, it's based on some state requirements. The health director today did say for Sac County, and we're seeing this in other counties, some small fitness studios might be able to reopen with some guidelines and things. For those, anything that is a gathering, that is still prohibited, and that would include our sporting events and some of these other elements. And he says it could be, again, going into late fall, even early winter, and possibly tied to the, a vaccine before we see that. So just letting everyone know that came directly from the health director, both in comments and calls he's had with the Metro Chamber and also his comments today to the county supervisors.
Right. Thank you. And so what we're going to focus on today is, as business is released to return back to work, what are you supposed to do as a business, particularly a small business with maybe not a ton of resources, and then also just awareness for employees. So one question that we're getting a lot of in our office is, what happens if you have somebody that has essentially 2 counties that govern, their person? They live, for example, in Sacramento County, but they work in Placer County. Placer's more open than Sacramento. There isn't a lot of guidance to answer that question, but it's our point of view that you shouldn't have to violate your county's order to go to work. So most likely the order where you reside would be the governing order in that situation. So we have a lot of employers asking that question as they're reopening. Can they, require their employee to go back to work if that would violate their local resident stay-at-home order? So there are a lot of helpful links on this slide. There's a ton of information about how employers should work to get their employees back safely. And these links here provide a whole bunch of that information. As we know, Sacramento County's order at this point expires on May 22nd. We'll be getting some more information, it sounds like, in the next 24, 48 hours on the next stage. And then YOLO, as it's written right now, expires May 31st. So if we could go to the next slide.
And it is looking, Jennifer, that they will continue to have a health order in place. They were just making revisions to it based on these later stages.
Okay, perfect. Yeah, this obviously is a very dynamic situation. As we're writing the slides, the guidance is changing. One question that we're getting a lot of touch on is the governor's announcement on May 6th. So on that date, Governor Newsom signed Executive Order 62-20 regarding workers' compensation claims. This executive order created a rebuttable presumption. So that means that any COVID-related illness is going to be presumed to arise out of employment if the employee tests positive within 14 days after the date of work, the work was not performed at the employee's home, and there is a diagnosis later confirmed by a positive test within 30 days. So one of the unusual things about this is that it was a retroactive action. So the period for which the presumption applies goes back to March 19th, and as of right now extends through July 5th. Again, very dynamic situation. We might see an extension on that July 5th date. At this point, we don't know. One of the issues that we believe prompted this executive order is the concern that there would be a lot of civil litigation out of the COVID crisis, and then reluctance for bringing employees back to work, and employees' concerns about exposure and the inability to have the care that they need. So we're hoping that this presumption, although it's kind of shocking news to many employers and businesses, will actually reduce civil litigation, which could be a great outcome. The question that we're getting on this topic is, does this presumption only apply to essential workers? And the reason for the confusion is that a lot of the media reporting around the executive order did include essential worker language. However, the executive order does not limit the switch on the presumption to essential workers. So if your employees come back to work, even if they're not on that essential designated list, and they meet these 3 criteria, then that presumption is going to apply to you. So that's it for this slide. I'm going to turn it over next to Amelya.
Thanks, Jennifer. All right, thank you, Erica and Lori, for putting this webinar on for your membership. I think this is very vital information, and hopefully it'll help your business community. So, benefits. As we think about bringing people back, happen to them, and the impact of COVID-19, we have to think about the policies associated with many of the slides I'm going to talk about, benefits being one. So let's think about the group health insurance. We have to redetermine waiting period issues due to leave or reinstatement, review any revised eligibility requirements during the layoff or furlough, and determine if those changes will be revoked and when. Also ensure coverage changes such as adding telehealth benefits now and services not subject to deductibles have been incorporated into the plan. Looking at our flexible spending accounts and those changes, over-the-counter medical products are now allowed under flexible medical accounts on a permanent basis and should be included in plan documents and communication. 401k and other pension plans, review those eligibility issues due to layoff or furlough. Consider break in service issues on counting years of service concerns. Review any in-service loans employees may have or will want to take, including eligibility and payback procedures, and then paid leave. So we've taught, I'm sure everyone on this webinar has learned a lot more than they wanted to know about FFCRA. So we have to look at FFCRA and the eligibility and track time used and collecting supporting documentation for tax credit purposes, and determine if there will be company PTO policy changes, including increasing or decreasing paid leave benefits or additional restrictions in using paid leave. So that's that slide.
Okay. I'm going to pick it up from here. Just another comment on benefits. I do have a lot of clients who are amending their plans, whether that is their health plan to cover employees who have reduced scheduling. So it's very typical that a health plan eligibility requirement would be an active employee working 30 hours per week, for example. So a lot of my clients are amending their benefit programs to keep employees on benefits even in light of reduced schedules. So it's important to work with your broker, work with your actual plan, Kaiser, Sutter, whomever that is, and get the plan amendment on file before you extend that out to employees. There are also companies that are holding on employer match for 401k or 403b contributions. Again, you're going to need to amend the plan formally before you do that, but there are a lot of things that can be done in the benefits arena to help conserve costs and extend benefits to employees during reduced work periods. Okay, next. All right, so again, there are multiple sources of information about how to return to work. We have the CDC guidance, we have Cal OSHA guidance, we have guidance related to particular industries. There's a list here: healthcare, agriculture, childcare, construction, grocery, logistics. But it's going to be kind of all best practices, reasonable health and safety information that you're going to want to look at your specific industry and consider PPE. If you have an industry that has aerosol transmissible diseases implications, be very specific and look at that. And what this is all going toward is gearing up for creating a return to work policy that's going to ensure that your employees can come back to work in a safe environment where we have the best option for reducing transmission and keeping employees safe. So let's go to the next slide.
Jennifer, maybe real quick before we go back on the Cal OSHA, is there, again, it's very specific to industry. I've seen a lot of these kind of recommendations with construction continuing on. Can you give maybe just one or two simple examples maybe for folks that as they're looking, is things they just need to be mindful of? And again, we encourage everybody to look specific to the Cal OSHA.
Right. So for example, in the dental industry, particularly, that's one of the covered topics. They're talking about airflow within the work environment. A lot of dental offices have gone to the more open feel, and unfortunately a lot of industries have gone to that. So we're having to kind of correct backwards. They're talking about some things that are applicable to across many industries. If you look at these guidance sheets, there are going to be repetition amongst them, which has to do with high touch areas, disinfecting workplaces, one-way traffic in high traffic areas of the work facility, and disinfecting. And so it's really common sense, frankly, but you just want to really look at your particular industry and make sure that you're just hitting on all touch points. Okay, so as you're bringing employees back to work, before they come back to work, and I know Amelya is going to touch on some of this later, but you as an employer want to develop a policy that's going to, again, take into account your industry specific information, county and state guidance, and the CDC guidance on keeping your workplace safe. So this is just a list of items that should be thought about and addressed in your return to work policies. The things that we want to think about is, are we going to be doing pre-screening at the office? Are employees asked to do that at home before they come in? Are we going to do temperature checks as people come into the office? And are we going to maintain that information? These are some of the most prevalent questions that we're seeing in our office, questions from clients, and you're going to want your written policy to address all of these issues. I'm going to talk in a minute about the privacy concerns that are associated with some of this, because we're in a very unusual time. And then towards the end of our program, we're going to talk about the need to plan as a business for what happens if people get sick. What are your continuity plans for if your top leadership, if everyone gets sick? What are the plans there, and how are you going to handle that? So this is going to be a written policy, and then you're going to have your employees trained on it. Preferably roll it out before people are actually coming back to the workplace, and then training them so that when they show back up to your workplace on that first day, they know exactly what's expected in the office, and they're feeling comfortable and confident that it is a best practices workplace where they're going to be safe. Okay, next. So usually employers are not in the business of maintaining employee medical information. Sometimes we have a little bit of information, you can come back to work or you need 5 days off, but generally employers try to stay away from knowing about employees' medical information. COVID has created a very unusual time in that regard. And so now employers are entitled to information as it relates to COVID symptoms, including employee temperatures, to screen and try to limit exposure of the virus. So there is also a new law in California that's, I think, coming into effect July 1st. Amelya, jump in if I've got that date wrong. And so if you are collecting employee information, you need to provide your employees with a notice under the California Consumer Privacy Protection Act. And if you're wondering, does that act apply to me? The criteria here for that act is identified. if you're collecting personal information, and so that's going to be the most broad interpretation of those words that you can conceive of. If you're taking employees' temperatures, if you're asking employees to pre-screen on respiratory symptoms, you are collecting personal information. And so typically that first bullet point, the company has annual gross revenues that exceed 25 million. That's where you're going to get most people covered by this act. But then there are two other alternatives if you're in the business of sharing or selling personal information. There's a very simple notice that needs to go to your employees if this act does apply to you. And we have an article on our website with more information about it. And you can find a notice there.
And again, Jennifer, I think on that, just for our audience, you know, I think for some folks, the thought of like, wait, do I need to now take my employees' temperatures and similar? Again, we've seen certain industries be very proactive in this early on. You know, our essential healthcare workers, obviously, I think are an obvious one, our construction crews and similar, where, you know, in addition to people just recognizing their own health before they come to work, of doing some temperature screening, it's one of the ways to do it. Until additional kind of testing and other things come online, that can be a resource. But you know, again, some of these guidelines are coming out from my understanding the state and the county on what some of these protocols will be. So it's not necessarily that everyone will require temperature screening for their employees. It could be certain industries, but if you are doing that, then you just got to be aware of some of these privacy concerns as far as the health of your employees' data.
Right, absolutely. These are all options to all employers for you to consider when you're bringing your employees back as a best practice for how to keep your workplace as safe as possible. And you know, I think we all know now too, taking a temperature, if I have a normal temperature, that doesn't mean that I don't have coronavirus. I mean, that doesn't kick in for several days. So it's not a foolproof system. And you know, I had a call from a client last week, and they said, well, we are doing temperature checks. Do we need to keep a record of the employee's temperature? You know, Jennifer's temperature today is 98.9. Do we keep that? And I said, you know, frankly, it's better not to keep it, because, you know, then you're maintaining that information. You have to keep it under lock and key. My advice would be use the CDC's normal range of temperature. You know, we all vary a little bit on our personal normal temperature, and then people either have a normal temperature or they don't, and that's all you need to know, and then they come to work if they're normal. Okay, I think I'm going to turn it back over to Amelya here.
All right, thank you. All right, more policy changes, and these next two slides are just you know, they're not exhaustive policy changes. You probably have specific ones indicative to your environment, but thinking about common sense, paid leave policies adjusted to reflect regulatory requirements and actual business needs. You're going to have to think about changing those. Or attendance policies relaxed to encourage sick employees to stay home. Time off request procedures clarified when employer requires an employee to go home. Flexible scheduling options allowing for compressed work weeks and flexible start and stop times for your workforce. Meals and rest breaks have to be adjusted and staggered for physical distancing. Travel policy updates to reflect essential and non-essential travel and the impact of domestic and global travel restrictions. Next slide, please. Telecommuting policies detailed to reflect type of work that can be done remotely. You know, that's one that I never even thought about, but now that people are working remotely, and we're going to talk about remote work in a minute, we may want to look very closely at how we're managing our employees and the telecommuting policies and the information policies that affect workers working from home, hardware, software support. And then lastly, how to handle the fear employees may have in coming back to work. And Jennifer's got a slide all about that, so we're going to get to that in a minute, but that, I'm sure everyone on this call it either has had employees say that to them already, or they're preparing for employees to say that to them. So that's a big one. So communication, establishing clear communication plans will allow employees and customers to understand how your organization's plans to reopen, or establishing business processes like we've been talking about. How staying at home when sick and physically distancing policies are being used to protect the workers and customers. Detail on what training on new workplace safety and infection protocols have been implemented. Have exposure response communications ready to go in case an employee or a customer is infected. Have media communications ready to release on topics such as return to work, safety protections in place, how the company is supporting the workers, etc. So there's a lot to think about, and we're going to talk about having committees and task forces and people to really spend work time to vet through all the very important changes to the policies that affect your workplace.
Amelia, before we go to the next slide on this point, and again, I think communication is so important in all this,
Yes.
communication internally and externally. So in the past, when you had, again, health information on an employee, it was treated very confidentially. If somebody was out of the office for any particular reason, there was guidance on, again, what you could and couldn't share.
Yeah.
In this context, if you have an employee that was positively diagnosed by a doctor or test with COVID, again, it sounds like you were obligated, you need to share with your other employees so they are aware of that. Is that an accurate assessment and kind of what you're sharing here?
You have to share that someone in the organization has been tested positive, but you cannot discriminate against the person that was tested. So you cannot share that information.
Great. And then again, I think part of this for folks to understand why that both internal and external is so important is this communication can also help with your customers. So they feel like they're coming to a safe environment and similar. So if they know that you're taking these safety measures, these protocols, your employees feel comfortable, they know what safety and measures and protocols you're taking. Again, this is not going to be one of these, we flip the light switch and everyone shows up.
Right, no.
There's a confidence factor we need with both our customers and our employees. And to a degree, the more we communicate and share with them and they know that this is a priority in the work environment, the better served we're all going to be in both reopening our businesses, but also being in a safe place.
Couldn't agree more. I'll give you a personal example. We were talking about dental offices a little while ago. So this morning I went to the dentist. I had to go, finally. And they are so particular about their office that I was the only customer in there. I was the only patient in there. Now, over time, maybe they'll have two, but the 6 feet apart, and they took my temperature, and everyone was in their masks, and I was in my mask until, of course, I had to take it off for the dental procedure. But I feel very, very confident that that dental office is working very closely with the protocols, and I feel very safe there. So that's an example of feeling, as a customer, feeling very safe about working in that, being in that environment. So I think the bottom line is think about putting yourself in your customer's shoes as business owners are on the call today.
And, again, we know for some of the folks on here, you might have departments that are specific to HR, specific to media or communications or marketing. For many of our small businesses, they wear many hats. So again, we don't want you to feel overwhelmed or intimidated by some of this. If you want to know what does that mean to have a media communications plan, again, reach out to us at the chamber. We can help you. We can walk you through what that might look like. So if you get a phone call from the media, whether it's because they just want to know, are you reopening and what does that look like, to, you had a customer or a situation or an issue, again, reach out to Lori or myself and we can walk through you on that or make it a future webinar as well.
That's wonderful. Very good. So recall procedures, plans for how and when employees will return to work or to the work site to create an organized and controlled approach is essential. And all employees, so for example, all employees returning on the same day may be overwhelming and actually possibly unsafe. So here are some thoughts: phasing in when you're phasing employees to return to work, think about using seniority or other non-discriminatory factors in selection. Consider adopting a work share program, bringing them back on a reduced schedule. Determine schedule changes to provide the greatest protection to the workers, right? We're thinking solely about the safety of our employees. Create a plan for high-risk categories for infection to return to work. So consider allowing these employees to work from home or remain on leave until they feel comfortable in returning to work. Determine increased measures to protect them when working on site, including isolated workstations, additional PPEs, as requested, fewer days in the office. So here's common sense again. We have to become very flexible and open-minded about employees' wishes and concerns as they begin returning to the workplace. Notify EDD of employees recalled to work and chose not to return. Determine how to handle employees who are unable or unwilling to return to work. So some of these items are employees who are fearful of returning to work, employees who have family obligations that interfere with their ability to return to work, or employees who remain under quarantine due to the exposure of COVID.
And Amelia, again, why is it important to notify EDD and similar if you do reopen or you are starting to recall employees to come back and they do provide whatever the reasoning might be that they're choosing not to return? And also, what is the difference if they say they're choosing not to return versus they're quitting their jobs versus whatever else it might be?
Well, Jennifer is going to talk about this from a legal perspective, but here you have employees who have been on unemployment. We have not had work for them. So if now we have work for them and they chose to stay home, not because they have a health condition and not because they are fearful of coming to work, they just would rather stay at home or maybe collect unemployment still and the federal $600 a week monies, then that will trigger to EDD to really look at payments, unemployment insurance payments to that employee, to get them off the state unemployment insurance. So it's vital that we keep EDD in with information on what's happening with our employees. Okay. So I think, okay, back to Jennifer.
So yes, thank you, Amelia. So this is one of the most common questions that we're getting right now, whether it's an employee. I think many of us have heard of people who either are making more money on unemployment or don't have a desire to return to work for a variety of reasons. And so once you have your policies in place, you communicate it out to employees, this is how we're going to stagger returns, and the employee refuses to return to work, what is the employer's response? So first, it's important to understand the reasoning behind the employee's refusal. So if there is an employee who has a reasonable belief that there's an imminent threat to their safety at the workplace, then they may have an option to stay at home. But generally, there is nothing that prevents an employer from recalling employees to work. You can also always continue to permit remote work if your, business situation allows for that. But without a medical advice or a diagnosis or restriction to stay home, generally employees should return to work. And if there is not a medical need associated with that, then there could be perhaps a separation of that employee. And that's, I didn't give my legal disclaimer at the beginning of the webinar, but it seems like a good time to do that. We're providing general information to everybody out there. Of course, when we're talking about separating employment and other legal action, it's important to consult with your own legal counsel or carefully consider that action. And, neither of us are providing legal advice today. So just had to get that on the record. one thing to also consider, and Amelia, thank you for referring to this earlier, is there are still a lot of reasons for protected leave from work. And so employees may have physical or mental disabilities, other medical conditions, could be pregnant, and employers still have their ongoing obligations to accommodate those needs and also to engage in the interactive process. And so for an employee who has a disability, as many of you are familiar, the interactive process is a two-way exchange of information discussing the conditions that the employee needs to be able to perform the essential functions of their job and potential reasonable accommodations. So all of us are anxious to return to normalcy, but in doing that as returning to work, we need to keep track of all of these other legal obligations that we were aware of before. Some accommodations could include remote work, a change in the employee's position or work location or work hours, or a leave of absence, which could be an unpaid leave of absence. Okay, moving on to the next slide. This is just kind of an overview of the CDC return to work guidance. I think all of us have heard all of this advice repeatedly. Even I was driving yesterday, and as I'm sure you all have seen, even the freeway sign says, stay at home, wash your hands. So it seems like people are inundated with this information, but we need to just keep up the reminders. Employees who are sick or have respiratory symptoms, they should stay home. If they become sick while they're at work, they should immediately go home. And just reminders on all of these prevention topics, how often to wash your hands, sneezing into your elbow, contact with people, personal space. In our building here, we have a one-way lobby now. And in the elevator, we have a 2 to 4 maximum per elevator. And there are a lot of spacing guidance like that larger buildings are putting into place. And it's a very helpful reminder just to see the signs, see the hand sanitizer stations throughout the common spaces of the building. Again, common sense, perform routine cleaning of shared workspaces, in a traditional work environment. For our office, for example, we're thinking about doorknobs and the high capacity copier and printer, and are we going to have the kitchen open when people come back to work? Everyone touches the refrigerator handle. The CDC advises that the virus can live on metal up to 5 days. So that's how we should all be thinking about this. How are we preventing the high contact transmission of the virus? And then in terms of travel, I don't think many businesses are engaged in much travel at this point in time, but if you do have employees that are traveling, you're going to want to check the local and state ordinances to where they're going, make sure that they're prepared. A couple other things that we're doing in our office is we're ordering masks so that if we have a visitor to the office who doesn't have a mask, we will give them. And this goes to Amelia's point of just making your employees and your vendors, visitors, clients feel safe when they come to your location. So, having the hand sanitizer at as many locations as possible throughout the office. I think that covers that one. Amelia?
Telecommuting may have proven to work well during the pandemic for some employers and employees, using it not only as a short-term emergency tool to survive the next year, but possibly a permanent work-life balance and cost-saving measures. And this is going to be very interesting as employers move through bringing people back to work and employees requesting to work remotely, what the philosophy is going to be in your workplaces. So things to consider: continue to allow remote work where possible to keep employees safe for right now, staggering weeks in office and at home among team members, or part-time remote work on alternative weekdays, responding to employees' requests to continue to work from home, including long-term arrangements, Update technology, we talked about that. Consider the long-term cost savings or impact of offering permanent remote work. And, you know, some of my Vistage members, of course, we've worked very closely with them over the last 2.5 months to ensure the success of their businesses. And, you know, not everyone's in favor of employees remote working on a 100% basis. They want employees back to work. And let's be frank, because we can see their productivity, right? We know what they're doing at home with so many distractions. It is difficult to keep up with the high performance. But we have to, of course, stay vigilant on the safety of our workforce as well as ourselves. So.
And Amelia, on this, I think something we're seeing with a lot of people, and part of the reason they are making a request or choice to work remotely also ties to childcare and kids and schools being out. So, you know, I think I'll use the Metro Chamber as an example from the essentially within 24 hours of the stay-at-home order going in place. We immediately set up all of our employees and our staff to work remotely. We have daily check-ins. We use tools like Asana to track projects and progress. You know, there's communication that goes on, not perfect by any means, but again, for those offices that might be able to have a work product that you can do that. For obviously, if you're in manufacturing, you know, you can't necessarily do that if you have people on a manufacturing line. But again, as an employer, what should I be mindful of when my employees are making these requests, and what can I do? Or is, again, you'd like to say common sense, but best practices for it.
Yeah, you know, we're going to have to, my recommendation is to take each case on its own merit and look at the job of the employee, the function, the requirement, the need for the employee to stay home. What are the conditions? We have to be so flexible with our employees' requests right now because they're all valid. They're all valid. It's perception and it's necessary for our employees to feel safe. So we can't put the hammer down as quickly as we may have prior to COVID-19 to say, oh no, you got to do it my way. No, now we have to be much more compassionate and transparent with our workforce. Next slide. Yep.
And that question does transition perfectly into this slide. You know, having employees, I'm going to just take the meal and rest period bullet first. Have employees at home, we don't have the visibility on what they're doing. And it's important just to make sure that employers are recognizing and aware of all the time that employees are putting in. You know, I've read some articles recently indicating that employees who are working at home are working harder and are more stressed out than they are in the office. And so for your non-exempt employees, you need to make sure that people are still keeping track of their start and stop times. They're taking rest breaks, you know, for mental health and for, you know, long-term drive. People are going to get burnt out if they're not taking their rest breaks and they're not taking their lunch breaks. And just keeping up with the paperwork of having non-exempt employees and making sure that they're getting compensated for all of their time, including overtime, and communicating with those employees to make sure that they're recording all their time. Because again, we can't see them, like Amelia points out. So that's very important. Going back up to the top of this slide, we've heard a lot about the term furlough. That is not my favorite term. I will be honest. In California, that term is really not recognized under California law. And so we get into a lot of disputes about what that really means when someone's talking about a furlough. Basically, in California, if you have an employee who is not scheduled during a pay period, usually your 2-week period, then that is going to be an implied layoff. And so people are using the word furlough to mean a lot of different things. The takeaway, I think, for today should be, if you're going to reduce employee schedules, keep employees working at least one shift or day during every pay period Otherwise, it could be interpreted as a layoff for which final pay and accrued vacation time would be due. So, and then obviously, you know, a layoff is elimination of employment, but that can be short term. So as we're talking about reopening and bringing employees back, it could have been, you know, or it still can be 2 weeks, 1 month, whatever you need as a business to be nimble and flexible during this complicated time. On exempt employees, this 54080 is the minimum salary for exempt employees. As cost-cutting measures are hitting all businesses, we're seeing employers and businesses who need to reduce exempt employees below that level. If you do that, and that's a fine strategy to take, but if you do that, your employee is no longer exempt. They're now a non-exempt employee, and they're subject to the timekeeping and meal and rest break requirements of a non-exempt employee. And that seems like a big change, but it's, again, probably going to be a short-term change. And then finally, alternative work weeks. As we're talking about rotating schedules, coming back to work in phases, there is an option under California law for an alternative work week. Most typically, we see this in some medical professions. People work 4 10-hour days, for example. That's available to all industries, but there are some quite technical requirements that need to be fulfilled for it to be legally available in your workplace. So before you go ahead bringing everybody back with, you know, 3 10s, 4 10s, whatever it is, make sure that you're consulting with legal counsel on that point.
Hey, Jennifer, before we move from this, just a really quick question. Is this for employers with more than 25 employees, or does this apply to everybody?
All employers. Yep.
Okay.
And I think Erica, I think the question really pertained to the compensation.
Okay.
25.
Oh, the minimum wage.
Yeah.
Yeah. So there is a different minimum wage for employers with 25 or fewer, and then it divides up at 26 or greater for that exempt employee salary. And so, yes, look at the size of your company and adjust based on that.
Yeah.
Good question.
Great.
Okay, new hire paperwork. We can't get around this. So employees returning to work who are furloughed and they're still connected to your company, they don't need to complete new paperwork. But those that are separated, like laid off workers, it might be best to follow the normal hiring procedures. And some of those recommendations are thinking about your employment application benefit enrollment requirements for rehired workers. Decide whether full or adjusted orientation procedures will be utilized. Submit new hire reports for new rehired workers. Notify state unemployment agencies of recalled workers, whether rehired or not. Address I-9 issues. If the employees completed the paperwork remotely, then complete in person upon the return to the workplace, and update any expired work authorization documents. Just to name a few. Next slide. So Jennifer talked about this a few minutes ago. I was on a webinar. You know, by the way, SHRM has had outstanding webinars as well over the course of the last 2.5 months. And I was on one last week with CDC. And here's the information that came from that. First of all, they say that 8 out of 10 employees are experiencing burnout, depression, and fatigue. They work longer hours without a break and have lost the control of independence. Well, I can just talk about me. I mean, 2.5 months ago, I left on a Friday and started opening up my 2 businesses on my dining room table with my cat meowing in my ear, my dog barking in the background. And, you know, I felt like I was 24/7 on the Zoom and computer on my little Surface screen. So I know exactly the health of how I was feeling. So we can't really forget about the health, the mental health of our employees and what they've been experiencing. So be honest and transparent with them about the policy changes and your company decisions that you're making. Be open to employee suggestions. You've heard me say this already. You know, employees should feel very supported about the culture of your company and how you care, empathetically care about these people. Decisions should be made in a participatory manner. And so our leadership styles can be certain ways, but if we can incorporate some participation with our employees, that would make them feel like they're included. Explain the why behind the policies that have changed. Offer resources if employees are struggling. If you really see them struggling at work or how they're communicating to you or some of the points that they're bringing up. CDC said that there's this organization called SAMHSA, Substance Abuse and Mental Health Association. It's a website that has so much information on mental health. So you can go there and just find out a lot of different information for you, whatever your specific issues are for your workforce. And they also offered a disaster distress helpline, which you can't really see on this slide, but if everyone gets a copy of the slides, then they'll get it. But it's 1-800-985-5990. And then the last, of course, is to go to SHRM.org. They also have quite a number of resources for you and your employees' mental health resources.
And Amelya, before we go to the next slide and kind of close out and do some questions here, just again to touch upon mental health, I think the key thing here is we are all feeling it in one way, shape, form, or another. Some more acutely. For a lot of our business owners, they are facing decisions on closing their business. It could be generational. It could be they're tied to their identity. What we'll do is we did a great Facebook Live event with the Sacramento Bee and WellSpace, and we went through both some of the resources for both employees and employers. We'll share that with everyone. And then the other thing too, just for everyone to know, is a lot of the resources you're seeing here, especially for mental health, we have on the Metro Chamber's Rapid Response Hub. And that website and that link is rapidresponse.metrochamber.org, which we'll make sure following this you have it if you don't already have it as a resource.
Awesome. Yeah.
All righty. And with that, we're going to touch upon this very briefly, just this idea of business continuity plans. And I think we are seeing more than ever the importance of businesses being resilient. Part of this goes towards, again, when a crisis hits. And I think for us as a region, let's be mindful that we are literally a city that was, for the city of Sacramento, was founded in a year of an immense fire, flood, and yes, a pandemic. At the time, it was a cholera pandemic. So we are a very resilient region. But as business owners, it's important, and or as managers, to think about what is that continuity plan. You know, if someone is sick, can't come in the office, an employee leaves, whatever it might be, and more than ever, this is really important to think about. And think about how you can support, again, that employee when they're taking that time off, or how you fill that void when it happens. Doesn't matter if it's because your executive chef in your kitchen is out, or your HR manager, or your administrator who's answering the phone. It's important to think through this and to think through what can be those support systems and those chain of commands to do it. If you have things in place, make sure you amend them. And part of this also means including emergency information, changes, and protocols. If, again, we aren't in a place where people show up for work sometimes. So again, if someone is going to report in for whatever reason, if it's because of mental health, if it's because they're not feeling well, again, what are those protocols? Who do they notify? And then as the manager, what are you doing to, again, fill that void to make sure the function of your business can continue? In today's world, that might be, and I think we've seen this at grocery stores, you might have employees that have to be at the door or have to monitor social spacing and similar. So again, you should always be thinking of that. And part of this might be cross-training employees so they can fill certain voids if you need to fill that in. Some businesses, bigger ones, you have like what we've called the pandemic task force, where they're staying up to date on the guidelines. Again, we have some great resources at the Metro Chamber with our Rapid Response Hub, where we know things are literally happening in dynamic times. With the county health order this morning, we're already getting emails from folks saying like, well, when can restaurants have, some partial in-dining component? What does that look like? How much notice can we get? Keep in mind our county health officials and our state health officials are doing everything they can But things are literally changing by the day, and part of that's being driven by the data. In the end, they're really trying hard to ensure that we've just got health and safety first, primarily because they want businesses to reopen more and more and more. And if we have a spike, then that means we kind of have to retract. So a lot of this is done in truly the interest of trying to get our businesses to be able to open more and more as it goes, as opposed to we see a spike and then things have to retract. And it is important to think about what would happen if there is a retraction, what would happen if you do need to close down. So this is always important. One of the key things, again, if you're thinking about what is your business plan, your cash flow, how do you restock, all these kinds of key things. The other thing that the Metro Chamber offers is we have free business counseling. You can call our triage hotline at 833-391-1919. We have experts there, including on the HR side, and they can help you with this. But it might help if you empower some of your employees. It gives them ownership of this as well, and they can be mindful of the training that goes with this. So if you're updating your policy on health and safety, if most of our businesses, you had that previously, there were health and safety requirements. You're just incorporating some new things into that. Make sure you train your employees, and again, empower some of those folks to do that training for you. Might even help. So we have just a couple minutes left here, and I want to open it up. We had a couple questions in our chat I'm going to address first for Jennifer and for Amelya. So maybe just to kind of start off, there was a question about, again, exempt, non-exempt. If they're only working one day for you, do you have to pay them for the entire week? And if you are switching them in between the two categories, what notification do you need to provide?
So my advice on that, Amelya, jump in, is that you would at least give them one pay period of notice of the switch. And if you have an exempt employee who's working one day a week, you should pay them for the whole work week. Yeah. So, and then I posted the exempt salary minimums on the chat for the 25 or less and 26 or more. I see someone else had a question, again, more about furloughs. Should I go ahead and address that?
Please.
Okay. So I think probably the question revolves around the implied layoff issue. So there's been a lot of discussion nationally about furloughing employees, essentially taking them on an unpaid leave of absence for a long period of time until the business can reopen. In California, that's really not recognized as an option because California interprets the absence of the employee from the workplace for without being scheduled during a pay period as an implied layoff. And so it's a nuanced area of the law, but there are two opinion letters from the Department of Industrial Relations that say that if you have employees without being scheduled during a pay period, that's an implied layoff, and then they would be due their final paycheck on their last day of work or within 72 hours, depending on the reason for termination. And at that time, they would also be required to be paid their accrued vacation, which of course is the opposite of what employers want to be doing right now, is paying out a bunch of accrued vacation time because everyone has a cash flow problem. So that's the rub of essentially the furlough issue. I know that there are some companies who are pressing the envelope on that locally. I just want to highlight that that's a risk that, your company needs to decide if you're willing to accept. And from what I hear, plaintiffs' lawyers are circling already on coming up with new class action schemes for post-pandemic cases. So I would say proceed with caution there. And if anyone has more detailed questions, I'm happy to answer them, offline.
Thank you. I think there was also a question for restaurant hospitality workers. Would they not be able to claim that they can't come to work because they're afraid of catching COVID? Again, if an employer says they're concerned about the exposure, whether they are high risk or not, again, what is the advice you give them?
So my advice, again, Amelya, feel free to jump in, is if they're not high risk, and I'm sure that all of our essential workplaces are putting in the appropriate precautions, then employees should be required to return back to work. I think Amelya had a good point earlier about handling individual cases on the facts of the case. So it's really hard to generalize advice there. But I
would also add that if an employee truly is fearful of catching COVID, returning to the workplace, please sit down with them in the interactive process and share with them all the wonderful things you're doing to ensure that they are going to be safe. Walk them through the protocol, show them the sanitation that you're doing, show them the mask, show them the PPE, do whatever you can to ensure that they start feeling comfortable that you are doing everything to make sure they're safe.
And Amelya, just to follow up on that, and we'll open up to a couple other questions if folks want. PPE is going to be something that we're going to see in our world and our work environments very much. So one, it's my understanding if your employees in the work environment, you need to provide that PPE. Is that accurate?
Yeah. I have not heard it one way or the other. I don't know, Jennifer, I've heard it both ways. It depends.
I would say provide it if you can. I mean, the trick is finding it, right? So if you can provide it, because I would put it in the category of a business expense. And then, there's a topic that we didn't even get to today, which is making sure that you're reimbursing employees for business expenses, working on cell phones, internet connections, that kind of thing, which could be like a whole nother webinar, but just want to add that in while we're on it.
And just so that folks know, I know PPE has been a concern. Part of this is going to be, you're going to have to think a little bit outside the box. There is PPE out there, but sometimes you're not finding it in traditional spaces. Previously, you might have been able to order supplies from Office Depot or go to a Target. That's not necessarily the case. In the chamber, we are creating a list of possible PPE resources that we will continue to update to the hub and a back to business section we're creating and share. The county's also working on this per some of the PPE being provided by the state. So we're looking to see what those inventories might be, what we can get in the hands of business. But I mean, right now, again, think about things like it may not mean you have a tiny bottle on everyone's desk. You might have one big bottle and you're refilling things, those kinds of stuff. But again, we will find some, we've got some folks in our kind of chat room that are even sharing some resources. With that too, and again, I want to make sure folks know before we open up to final questions, at 2 o'clock today on Facebook Live, we're going to do a chat with our CEO, Amanda Blackwood, and the Cal Chamber CEO, Ellen Zamenberg, who is immense and wonderful, and is going to talk about what some of these implications are with California as things reopen, and also what small businesses can do. So know that, again, if you're looking for more information, what do these later stages mean to you and your business? There's another resource. This we'll share with you. And again, for many of our Facebook Live chats that we've been doing Tuesdays at 2, that data is out there, and Lori will circle around and share that. So I think with that, we'll very quickly, and I want to keep it short because we are over time, we're going to unmute you guys. If there is, so if you do not want to ask a question, just mute yourself back. But if there is someone, why don't you go ahead and jump in, and we want to make sure we address any questions before we close out.
I have a question. Is there a company liability issue that for this cleaning supplies that you provide are documented as killing, COVID? I.e., you can't find Clorox wipes, so you've got, generic off-brand organic whatever that maybe is, not with bleach. Is there a is it finding specific cleaning supplies or any cleaning supplies? I'm concerned with the company liability side, especially with this being a workers' claim, that if we don't clean the microwave well enough, it comes back to company responsibility for the illness, the death, the whatever.
Yeah, my advice is to follow the CDC guidance, and most of the guidance, you can create your own bleach and water solution that meets their standards. And so then you could tell all of your workforce, and it could be your policy that you're going to follow CDC guidance on cleaning supplies. And I haven't heard that there's a shortage on bleach yet, but that could be the next one.
Oh, I'd like to, if I could just add that there's through the Vistage organization, there's a company in Sacramento that is going in after you bring in the sanitization companies who really sanitize everything about your organization, and then you bring your workforce back in. So this organization also has a new product that can test if COVID is still on the counters, that if there's some sort of COVID still remaining. So it's a follow-on to the sanitization that is going on right now in our workplaces with these companies.
And
Can you
again,
share that, Amelia, please?
part of this is industry specific. So we know that for some industries, whether it be construction, healthcare, similar, they've had different restrictions on the types of masks, whether you need to wear gowns and similar. Again, this is where I think a combination of, we've seen some of this with Cal OSHA, and then also we'll see more guidelines from the state in the next few days with the latter stage 2s of what those guidelines are. They've got a guide for restaurants, for example, that gives some indications of what some of those PPEs are and what some of those health and safety standards are for following. Any other questions out there for the group? Going once.
Hello.
Yeah.
May I please ask, on the first slide or second slide, there was a comment about the workers' comp, and I didn't catch that. So is COVID covered under workers' comp, or it's not?
And so there is a shift pursuant to the governor's executive order that indicates that if an employee tests positive, if an employee's returned to work, so if all your people are working at home, this doesn't even apply to you. The time period that's relevant is March 19th to July 5th. And if in that time you have an employee who tests positive within 14 days after a date they worked not at home, and there's a diagnosis confirmed by a positive test, then the presumption under workers' comp is that the employee contracted a COVID-related illness at the workplace. It's a rebuttable presumption. So as we're talking about cleaning and sanitizing and PPE, those are all the things that you're going to use to rebut the presumption, and documentation around your use of that. And hopefully that answers your question.
Thank you. This has been very helpful overall, by the way.
Thank you.
Good, very good.
Any other questions from the group? And again, if you want to share it in private, you email it to Lori or similar, and we will do our best to get you an answer. Again, we really appreciate everyone participating, and also encourage you to refer to, if you have legal counsel, if you have HR professionals, use them. They are a huge, tremendous resource to you right now. Any other questions?
This is Dave Petrie. It's not necessarily a question, but I have a whole list of free and inexpensive tools that people can use to help foster their teleworking employees. Because I think a lot of people struggle with that. So if you want that, I'll email it to you or whatever, and you can post it up or whatever.
That'd be great, Dave. Thank you very much. And I encourage everyone within our membership. We've been very much trying to promote both our members that are offering resources and tools, as well as those that have, services at this time. So please send it to Lori, and we will either find a place for it to share with membership, put it on the hub or somewhere. Any other questions for the group? Well, with that, I do want to really thank here both Jennifer and Amelya for their time, their expertise. We will share with this group some follow-up. This recording will be available for later. I really encourage you, again, things are changing literally by the hour, if not by the day. And it's just a little bit of the life we are in. It is not business as usual, but it is still business. And the Metro Chamber is a huge resource to you in that regard, both with our hub, our business counselors. Please reach out to our membership team. We may not always have the answers. We will do our best to find them for you and take care of that. Just know that, again, you are not in this alone. I know a lot of what we went through today can be overwhelming. Just take it a piece at a time. And again, if you need to talk through somebody with this, our business counselors are available at 833-391-1919. Again, that is 833-391-1919. And with that, again, thank you, Jennifer, Amelya, Lori, Chloe, and team, and for all of you who participated today. We really appreciate it. And we appreciate you continuing to be part of our business community, giving people a safe place for people to work and for our residents to shop, enjoy, and otherwise. So thank you.
Thank
Great
you.
day,
Thanks,
everyone.
Erica.
Bye.
Bye.